Let's talk about the SAPHO syndrome. Now, SAPHO syndrome is a very uncommon disorder, but it is usually found in the patient, especially if you're working in the rheumatology wards. SAPHO syndrome is an acronym where the SAPHO stands for S for synovitis, A for acne, P for postulosis, H for hyperostosis. Hyperostosis means the hypergrowth of the bone tissue, and O stands for the osteotitis or the generalized inflammation of the bone tissue. Now, what happens in SAPHO syndrome is that the clinical findings are that the patient has acne. Now, acne is the hallmark of the SAPHO syndrome. Now, this acne can result in palmoplantar pustulosis, that there is pustular appearance on the both palm and the soles of the patient. Patient might have acne conglobulata, that there is acne along with the pustular nodules which are draining in nature. So acne conglobulata can result in a further swearing of acne, which is usually termed as the acne fulminans. Now, acne fulminans is a type of acne where the patient's acne pustules start to crust, start to drain into fistulas, into draining pustules and boils, and because of this, whole of the body of the patient starts to get covered in acne, starts to get crusted, and different types of both hyperpigmented areas start to form. There is also hidradenitis suppurativa. Now, hidradenitis suppurativa is a condition where some kind of a hard nodule forms under the skin like a lipoma, but unlike lipoma, it starts to form small drainage areas where pus starts to come out of it. Now, they are usually clustered together and form a kind of a ridged area where different needle-like marks are present. And this is a very typical presentation usually associated with the SAPHO syndrome. Next, we have the sternoclavicular and the spinal hyperostosis. Now, the sternoclavicular is the area where the sternum and the clavicle join together. Now, this is a fibrous joint, and any outgrowth at this area will result in pain and the compression of both the jugular and the carotid arteries. And spinal hyperostosis, that is the extension of the spinal processes which are found at the posterior region of the spinal cord. When there is outgrowth of these processes, that results in the pain with the movement and low range of motion. Along with these, there's recurrent foci of sterile osteomyelitis. Now, the sterile osteomyelitis point is important because osteomyelitis, that is the inflammation of both the bone tissue that has now even infiltrated the area of the bone marrow, is sterile, that there is no bacteria that is involved in the osteomyelitis. So if there are recurrent foci, that areas of sterile osteomyelitis with axial and peripheral arthritis, along with the acne and the skin problems, we can easily diagnose this patient as having SAPHO syndrome, because in this patient the synovitis will come from the arthritis, the acne will come from the acne conglobata and the acne fulminans, the pustulosis will come from the palmoplantar pustulosis and the hidradenitis suppurativa. The hyperostosis, now that comes from the sternoclavicular and spinal hyperostosis, and osteotitis comes from the foci of the otitis and osteomyelitis, which are sterile in nature, that there is no bacterial involvement. So when we link all of these together, we have the SAPHO syndrome. Now, in order to diagnose the SAPHO syndrome, we have certain tests, like there's elevation of the ESR or the erythrocyte sedimentation rate. We have culture and biopsy, that we can both culture if there's any organism responsible for osteomyelitis, if it is non-sterile, and we can do this by performing the biopsy of the bone. Then we have the radiographs, and radiographs will show both hyperostosis and osteomyelitis. Next is the treatment of the SAPHO syndrome. Now, in order to treat the SAPHO syndrome, the main line or the drug of choice is the NSAIDs, and NSAIDs are given in large amounts. So in order to cure the SAPHO syndrome, the NSAIDs are used, and along with NSAIDs, we also have the additional benefits of the anti-tissue necrosis factor alpha, monoclonal antibodies, and sometimes if SAPHO syndrome is much worse, we can even use the immunosuppressive drugs. So this was the lecture on Spondyloarthritis, where we learned about both the ankylosing spondylitis, what it is, how to treat it, how to diagnose it. We learned about reactive arthritis, about the diagnostic criteria, what it is, how it presents itself. We learned about the enteropathic spondyloarthritis. We learned about the psoriatic spondyloarthritis. We learned about the SAPHO syndrome. We learned about both the juvenile and the undifferentiated spondyloarthritis. Now you can find this lecture along with the lecture on ankylosing spondylitis on sqadia.com, where you can find lectures on topics ranging from biochemistry to physiology to pharmacology to pathology to courses in radiology to rheumatology. You can find almost all kind of topics of medical education on sqadia.com. You can even start your 2-day free trial on this website. So thank you so much for watching sqadia.com.